Oh, give me a kiss.
Oh my goodness.
That's more than we need. Don't teach him some bad.
Let's say enjoy it.
So we're pretty good about taking him out.
He's full of energy.
Oh, Jeff, you just don't know how much energy. He's got
Yeah.
so much energy, I can't really teach him much. But he does know sit, he does know his name.
Mhm.
But as far as anything else, I mean, he's like bouncing off the walls all the time. So
Yeah.
the real reason I'm here today is to get a tranquilizer
Oh, yeah.
for me and him.
Yeah.
He's crazy, he really is. And bite is true. Good
Yeah, you're a retriever already, aren't you? I got a treat for you. Look at that. He's so
Oh,
smart. You gonna take him to class?
Yep,
Yeah.
starts back
Good.
3rd March.
He learned to sit in about
Oh,
3 minutes.
Yeah.
I mean, the sits that we really bad.
Yeah.
I know how to do that, but he is so stubborn. Oh
Yeah.
my gosh, he's so stubborn.
It's just that you have
Yeah.
to like
Wait.
really be on when you're on with him because the response time and the timing of the rewards and stuff is so quick.
Yeah,
And he's so on to the next thing already. You know, you gotta be really.
and I'm worried about the way he pulls. I'm worried about his throat.
Yeah.
I'm thinking about a martingale collar. They say it doesn't
Mm-hmm.
hurt his neck as much.
Or general leader.
Or general leader.
General leader's really good. Yeah.
Which one do you like?
I think my yellow lab was like that, and he was 100 pounds. You know, so and but it's literally it's so gentle. You just you turn his nose like that, and then he can't keep pushing forward. And so if you use it properly.
Yeah, we used it on Zara.
Oh, okay.
Because Zara was a CCI
Yeah.
dog,
Mm-hmm.
and you had to.
Oh, okay.
Yeah, they gave you one and they said use it, and so we did it with
Yeah.
him, and that was fine, but.
That is
Zara
actually the
was
best.
never-
It's the most gentle because it's
Yeah.
wherever the head goes is where the body's gonna go. You know. Versus where if you're pulling on his collar, there's different things that you're trying to snap his attention. So
Yeah.
you've got to pull harder. But
I might, as a matter of fact, I may have Zara Blow general
Mhm.
later, if not, I might give him another one to
Yeah.
try.
but you got to be the crazy.
He knows
the
where you
treat
keep
Yeah.
the treats.
He's smart.
I was sitting on the floor today in the den, and I was trying to train him, and
Mhm.
he knows treats were in his pocket.
Walk in all different directions. So as soon as he goes to the end of the leash, you turn and go to another
I
direction.
saw that on the video.
Just go random directions. So he's after a while he's like, well, I don't know where you're going next.
Right.
I'm gonna start paying attention to you.
Yeah, I'm
You
gonna
know?
try that. I'm gonna
Yeah.
try that. The rain hadn't helped,
No,
It was so rainy
that's
lately.
right.
But I
You
know
check
that.
me all over. You like treats. You're food oriented. That's
Oh,
good.
he is.
Mhm.
Those are good.
I'm gonna take those and put them over here for a second. There we go.
It's definitely food oriented, and that's good
You're
because
fun
they
to
are.
play. He's you fun to play with. So we got a
He
kiss.
will nip.
Oh, give me a kiss.
Oh my goodness.
That's more than we need. Don't teach him some bad things.
That's what we say, that's more than we need. Oh, Lordy.
And listen to your little heart. What's that? It's not a chew toy. That is not a chew toy.
It's
Hold on, wait, worm.
very busy all the
So I
time.
got stuff to do.
Sounds good.
Good.
That sounds normal.
Place. Of course, that's pretty easy.
I don't know what that is, but let's say enjoy it.
So we're pretty good about taking him out, and
Uh-huh.
the first couple of days he did have a few accidents, but last 2 days I don't think he's had any accidents in the house.
Mhm.
The only time he does is like today. I guess one time today after lunch I fed him and I put him in his crate because I had to do something else. I took him out of his crate and he got so excited he found that litter. And actually it was like the day after I came in here and I asked you about that.
Yeah.
Somebody came on the name. Well, we found this litter right then, and so we went and visited the day after Christmas, and
Picked him out that day.
picked him out that day.
Oh, that company and the Royal Canin Company, those are very good. But we want something for large breed puppies because the large breeds take longer to grow. They take more energy. We want him to grow slowly over a year and 3 months to get to his adult weight because that's largely genetic. Whatever his parents were is what he's gonna be.
Yeah.
If we grow him too fast, there's just a regular puppy food, then he can outgrow his bones, so to speak. So he has problems with the cartilage forming in the joints and stuff like that.
Does he need a calcium supplement or anything like
He
that?
shouldn't need one if we do the large breed puppy. That's a big part of the calcium phosphorus 8 ratio is a big thing. So if you mess with that, you can have mistakes.
Okay, so we
So-
can do we can start mixing in a large breed puppy with his Victor just to mix it in with him. We think, and then
I would switch him half and half, and then
Half
switch
and half.
over the next week. Switch him
Okay.
over to a large breed.
okay.
Yeah.
Yeah, I was worried if he wasn't getting enough from that dog food. That's what she was giving him. And, He's really serious about that.
Yeah,
I know
he
it.
is. So when we're preparing for anesthesia, the number one cause of infection after surgery is the source of bacteria comes from the skin. So getting the skin clean is a number one issue for us. So we got to clip the hair to remove all that source of bacteria and then scrub it clean after that. One of the things you can do if your dog's coming in to have surgery, be spayed or so forth, then the day before is give them a really good bath and get them clean. That makes a big difference for us when we're doing surgery. The thing about bacteria is that we can't see the bacteria. We don't know where it is. So when we do this surgery prep, Emma's starting in the center, and you notice how she goes out to the periphery as she goes. She starts at the surgical site, and then she moves outward as she scrubs. So the cleanest spot is right in the middle, and then if she happens to pick up some bacteria, if she's dragging it on that gauze square, she'll be dragging it out to the outside. And we do this multiple times to make sure she's clean. So this is my sterile gown, and these are my sterile gloves. I'm going to open these up without touching them. So we've scrubbed the dog and try to eliminate bacteria. One of the things I do with my lab coat is really a cover that I protect myself from all the germs of the world. Before I go into surgery, I take this outer cover off. And so I have clean clothes on underneath. And then I'm even going to do, before I go into the surgery room, I am going to change my shoes. I take these shoes off and put these shoes that I only wear in surgery. So I'm not tracking any bacteria in there with me. And so then I'm going to go through the same scrubbing process with myself that we did with the dog's skin. So I'll scrub my hands 3 times just like we did the dog's skin, but I'll even actually go through a process where I try to get each fingernail, and then I do each finger on each side and try to go through this methodical process to make sure that I've covered all the areas, because you can't see the bacteria that's on your skin. You want to scrub every inch of it to make sure that you've done it, and we'll rinse this off and we'll do this 3 times over. Now Emma is in the surgery room and she's putting on sterile gloves, so there's absolutely no bacteria on her hands at all, and she's using sterilized gauze to use the scrub. And she will do the same technique with the circles starting in the middle and working her way out towards the edge, and even going to the extent that she's using her left hand to touch the sterile gauze and transfer that to the right hand, and the right hand touches the dog. So that keeps a potential for bacterial contamination from going the other way. So this gives us the cleanest possible surgery site that we can have. Hey, I've got myself all scrubbed in. I'm covered in, this is sterile, the gloves are sterile, this drape is sterile, which means there's no bacteria on it at all. And the dog is clean. You can never sterilize the skin. You can only reduce the bacteria on it and get it clean. So then I'm going to drape this in. So now I've covered up most of her body and I have just the sterile field exposed. So we have a limited amount of bacteria here that can contaminate our surgery site. So this little girl is a lucky one. She just got spayed today, and she was adopted out through the Danville Area Humane Society. So she looks to be a purebred Rottweiler. I don't know what her story is, and she's an adult dog, and she's very sweet and well adjusted and trained. So when you're going to get a new pet, think about going to the shelter and getting a dog. They have all different types of dogs there, and we saved one today. We try to have a staff meeting every week to keep in touch with each other and to learn some new things. I think the best way to learn something new is to teach it. So we get some of our staff to participate, and everybody gets...
Typically, I'll be going over the common tick-borne diseases that we see here at our clinic. So Lyme disease is actually transferred by the black-legged tick. That's actually also known as the deer tick and the western black-legged. Anaplasmosis. So anaplasmosis is transmitted by the black-legged tick as well, and the western black-legged tick. And if you guys look, I just put this little picture up of all the different stages except the egg stage of the black-legged tick. So that's what it looks like as an adult, a nymph, and the larva.
Is that a dime beside it?
It is, yes.
my God.
They're very
Yeah.
small. Of course, we have the Lyme vaccine, so you can vaccinate for Lyme disease. And then you can also keep your pet on flea and tick preventatives year-round. And then another good practice to get in is just inspecting your pet for ticks on a daily basis and removing them if you find any.
My mama said, I understand why people end up with their human babies in the bed. Their human babies in the bed. Yeah.
Yeah, I'm on second these last 2 weeks, and she's it didn't deal with her till I get home, and then I take him out, and then he wants to come in and get in bed, and he has to do his little ritual of biting on these things and things like that, with the toys and all, and then finally I cut the light out and just lay down. But he tickles me, he gets up and just flops up again.
He had to get up right away.
Yeah, she's a cuddler for sure.
Yeah.
Now, she did sleep in her crate last night. Okay, you're going in your crate, baby.
We would get in a crate for him because I think maybe.
If Justin's not home, or we
Yeah.
need to go somewhere,
yeah,
whatever,
yeah,
now, we put him in there and
Hey, girl.
won't have the whole house over. But that dog that Tracy and them got actually tore them wire crates up.
He
my
did.
gosh.
I mean, he tore them up. Keenan had weights and stuff sitting on the doors and everything, pushed, and he still tore them up. And they got a cat.
Oh,
Yeah,
I
got
can't remember who this. I must be 9, 10. I lost track.
I can't.
Yes, yes. We know. Yes, of course. Of course. That's all you had to say? Yeah. Yeah, you just tell us. You just tell us. We're here to listen. Yeah? Is that how you feel? Is that how you feel? Yes, my goodness. Yes, my goodness.
Seems to feel pretty good.
I know.
Surgery didn't slow him down any.
If I had a little leash, we'd walk around. What are you doing? What are you doing? Look at you, big man. You look so happy. You're just going on a little walk. So, it's very common.
There's the. Oh, you saying it. You saying it. Oh, hello. You are.
Oh, Boozy.
It just smells bad. You can't eat it.